Welcome to Ashley on CBD, your one-stop podcast where we drop the truth on all things CBD and maybe some pop culture too. Stick around as we delve deep into the practical health benefits of CBD for you.
Welcome to the show. Thank you for listening. Today's episode, as always, is brought to you by Magic Immuna Tea, available at packedwithlife.com. What could be more important in today's world than having a strong immune system? Probably nothing. But how do you do that? Diet, exercise? Well, no kidding. But what I've recently started doing is drinking Magic Immuna Tea. Number one, it tastes great, and it's loaded with healthy nutrients called adaptogens, including 4 essential mushrooms, reishi, lion's mane, chaga, and cordyceps. No, not the magic kind, you guys. Come on. Reishi, lion's mane, chaga, and cordyceps are great for you. Highly nutritious and very adept at boosting your immune system. So give Magic Immuna Tea a try at packedwithlife.com.
Hello and welcome to the show. Today's guest is Dr. Tom O'Brien. He's the author of the book, You Can Fix Your Brain. He's also the proprietor of thedr.com, and he's recognized as one of the world experts on gluten. An amazing conversation we have, lots of insight for those of you who are interested in anything to do with wheat intolerance or gut health, leaky gut, and so forth. An amazingly informative session with Dr. Tom O'Brien. We go almost for a full hour. So lots of info here. I hope you enjoy the show. Take care. Hi, Dr. O'Brien. Welcome to the show.
Well, thank you so much. It's a pleasure to be with you.
Well, I'm so excited to talk to you. Thank you today for spending time with us. It's our objective here is to try to help spread awareness and understanding and education around the role of cannabis and CBD as it pertains to health. So your expertise in gluten and many other things I looked at in terms of your background and some of the things you had to say about air pollution and Alzheimer's and plants that can take some of that stuff out of the air. I mean, there's lots of things I want to talk about with you. So thank you so much for being here. And why don't we just start by give us a little bit about yourself. Tell us who you are and how you got into this space.
Well, I guess the most relevant things are that I've been on faculty of the Institute for Functional Medicine for the last 10 years or so. And for those that don't know, functional medicine is an approach to healthcare where we train physicians on identifying the mechanisms behind why people have what they have. That we're all trained that if you have this symptom, you give this recommendation, right, to deal with the symptom. And so many people now are talking about, well, we look at the root cause, we look at where it's coming from, but many times holistic practitioners are looking at what safer recommendations can I give for the symptoms opposed to the pharmaceuticals that may have side effects. And so what's a safer approach to deal with that symptom? And functional medicine is, we of course are going to focus on helping you feel better as quickly as possible, but where are these symptoms coming from? Your high cholesterol is not a symptom of your liver making too much cholesterol, and that's where cholesterol comes from, is the liver. Mm-hmm. But the drugs shut down the liver's ability to make cholesterol. And that's how the drugs work, is to shut down. But the question is, why is your liver making so much cholesterol? And what people don't know is that the LDL cholesterol, the one we call the bad cholesterol, is actually an antibacterial. And LDL binds with something called LPS, which is the exhaust of bad bacteria. It binds it up and escorts it out of the body. So if you've got a lot of LPS, then you may have high cholesterol because your cholesterol is grabbing this stuff to try to get it out. And when you can't get the LPS out and it accumulates in your body, it accumulates in your spleen and your lymph nodes and in your brain. And the end stage of too much LPS accumulation is sepsis. And sepsis kills 1.7 million people a year get sepsis in the US, and it kills 250,000 people a year. And it's just
Holy cow.
the end stage of a whole lot of crap that's been accumulating in your body for 30 years. And, so you don't deal with high cholesterol by taking a drug to get your cholesterol down. That's a concept behind functional medicine, and what we do is really explore, why is your body doing what it does? And
So is your research, because you're, one of the most renowned experts on gluten and a gluten diet and the problems with that, is your assumption or hypotheses, or maybe even proof, that what we're eating, and specifically gluten, causes then that reaction in the liver that causes this whole problem that you're talking about?
Oh, that's a really interesting question. We have the same body as our ancestors thousands of years ago. The same kidneys, the same gallbladder, the same brain. We use our brains more, and we've developed comforts like housing and warmth in the winter and food and all of that, which is really interesting for this interview because of the topics of CBD and all of that. And we'll get to that. And our ancestors, their main emphasis was on food and housing. They're always trying to find enough food. So they're foraging for food, and they find something. First thing they do, they sniff it. Second thing they do, a little taste. And if it seems okay, they eat it. If there was really bad bacteria in that food that they found, but not enough to smell bad or that would stimulate the taste buds, it's the hydrochloric acid in our stomach that's supposed to kill that. Hydrochloric acid kills anything, but it can sit in your stomach all day long. That's the beauty of the human body, but this acid will eat through wood. It can sit in our stomach. It's supposed to be able to sit in our stomach all day. But if any of this bad bacteria in this example, and for our ancestors, got past the acid and out of the stomach into the small intestine, we have sentries standing guard just inside the first part of the small intestine. And they're called toll-like receptors. And it's toll-like receptor 4. And I'm sorry to be geeking out.
No, this is perfect.
But toll-like receptor 4 is to identify bacteria, bad bacteria, not the good bacteria, but threatening microorganisms that can hurt you. And if toll-like receptor 4 identifies a bad bacteria coming out of the stomach, it does two things immediately. First thing it sends a message that says, we need help here. And that message activates the production of a protein called zonulin. And zonulin is the mechanism that causes what's called intestinal permeability, slang term, leaky gut.
Mm-hmm.
So the toll-like receptor sends a message, we need some help here. And what zonulin does is it opens up the cells, a little space between the cells, and you leak from the lymphatics and the bloodstream into the gut a bunch of water. Why? Because you're going to flush out whatever this threat is that just came in. And you get a little loose bowels or diarrhea. And that's the concept behind what leaky gut is that it's your body's way of protecting itself, activated by toll-like receptor 4, because there's a bad bacteria here that got in. So wash the thing out. It's like mud dries on your driveway. You got to take a powerful garden hose to wash that stuff off, right?
Right.
So leaky gut is not a bad thing. It's actually bringing water into the intestine to wash out a threat. That's the first thing the toll-like receptor does.
Interesting.
The second thing it does, it sends a message to the surrounding area saying, I need some help here. And here come what are called the inflammatory cytokines to attack and kill whatever this thing is. So you create inflammation in the gut when there's a bad bacteria coming in. That's the job of toll-like receptor 4. Sits there all day, every day, doesn't do a thing, just standing guard like whatever those guards are in England,
Right.
Whoever they are, but
right.
They stand stiff all day. That's toll-like receptor 4. Now, what we know, no doubt, Professor Maureen Leonard, famous gastroenterologist at Harvard, in 2017, She read 64 different research papers on this topic, and she concluded beyond question, wheat coming out of the stomach into the small intestine activates toll-like receptor 4, causing transient intestinal permeability in all humans who eat wheat.
Wow.
All humans. Every time. You just don't feel it, right? You don't feel it, but that's what's going on. Well, I don't have diarrhea every day. Well, you did when you were a kid, and now your body's compensated in other ways because that didn't work. And so there's other mechanisms, backup mechanisms that occur. So this question about gluten and is gluten a problem, it's really not just the proteins in wheat called glutens, but there are other components in wheat also. So it's wheat that causes the problem.
So basically, all of us have an allergic reaction to this. It's just that some of us don't. It only presents itself as being serious in some of us.
Well, that's an interesting. Your words are allergic reaction, which means that the immune system is involved.
Right.
Now, there is something called oral tolerance, and oral tolerance means that you can have a little of this, and the immune system lets it slide.
Mm-hmm.
Right? Toll-like receptor 4 doesn't let anything slide, but it causes transient intestinal permeability, meaning it's not permanent leaky gut. So, Mrs. Patient, you have an entire new body every 7 years. Every cell in your body regenerates, every single cell. Some cells really quick, like the inside of your guts every few days. Some cells are really slow, like bone cells, brain cells, but every cell except your teeth, every other cell regenerates. So what happens, you have a little wheat, toll-like receptor 4 gets activated, sends a message to the gut, says, wash this out. You get zonulin proteins made, opens up the cells. You get transient intestinal permeability, but it heals. It closes up. The problem is our ancestors, our ancient ancestors, how often did they eat wheat? I mean, you've got to find these seeds,
Right.
and you chew them a little bit, or you might grind it up. I mean, there's a heck of a lot of work to get this
pretty rare
done.
too to find it until you were farming, right?
Exactly. So this is before agriculture. This is like 10,000 years and older. And so it wasn't a big deal. So you tear the lining of the gut a little bit, but it heals, no problem. So that's called oral tolerance. Now, what's happened is toast for breakfast, sandwich for lunch, pasta for dinner, croutons on your salad, day after week after month after year, you lose oral tolerance. When you lose oral tolerance, the leaky gut is not transient anymore. Now it's permanent. And we know that the leaky gut is number 4 in the 5 pillars of the development of all disease, all inflammatory diseases. There are 5 pillars, and maybe we'll get to that. But number 4 is the leaky gut. But that is the pathological leaky gut, not the transient leaky gut. So when you cross that line of tolerance and your immune system says no more, now you start making antibodies to wheat. And when you make the antibodies to wheat, now you're getting an immune response. Now that's what we call the allergic reaction that occurs. You may not feel it in your gut. It may manifest as brain dysfunction or psoriasis or rheumatoid arthritis or acne, or any cell of the body may manifest. It just depends on where your genetic vulnerability is. But when you're causing this excess inflammation all the time, and your immune system's trying to protect you, you've crossed that line of tolerance, your immune system's trying to protect you, now you've got these antibodies to wheat in your bloodstream. And because of a couple of different mechanisms, those antibodies looking everywhere for wheat in your bloodstream, your bloodstream's just a highway. I mean, there's lots of traffic on the highway. They're all going the same direction, but there's no lanes, there's no organization. Everything's bouncing around like bumper cars in there, right? But these antibodies are looking for wheat to fire their chemical bullet to destroy it. And it's
nonstop wheat, basically, for most people.
Yeah, exactly. And the way these antibodies are trained, they just go after wheat. They're special forces. And so they're highly trained. And how they know who to attack is they're looking for a protein signature. And I call it orange vests. They're looking for orange vests of all the stuff that's in the bloodstream. They're looking for orange vests. And the orange vests are a protein signature. And I'll say AABCD. It's the protein signature. I'm making that up, but they're looking for a specific protein signature. Now, as the blood's going past your thyroid, as an example, all the tissue that faces into the bloodstream is made up of proteins and fats. And these proteins are hundreds of amino acids long, but some of them include AABCD, orange vests. So the antibodies that are looking for wheat in the bloodstream, look over there, and they fire their chemical bullet at your thyroid, if that's your genetic vulnerability, or at your brain, if that's your genetic vulnerability. And now you're causing inflammation and damaging thyroid cells or brain cells or skin cells or joint cells, wherever your genetic vulnerability is. And now you start creating antibodies to the tissue that's been damaged. So now you've got thyroid antibodies or myelin antibodies in your brain. Myelin's a saran wrap around your nerves. When that gets destroyed, you got MS. And that's the mechanism of MS. But all of this stuff occurs because of inflammation, because your body's trying to protect you from something that got in that's not supposed to be there.
Be darn.
So
you don't eat wheat, right?
I'm sorry?
You don't eat wheat.
Oh gosh, no, I wish I could. I wish.
Yeah.
I mean, I'm half Italian, and I grew up on homemade pasta, homemade ravioli, homemade mostaccioli, and
yeah, I stopped eating. Back to my portion control, right? Like I stopped, which means I eat just very, very small amounts of it these days. I try not to eat it at all, and it's very difficult. And the worst thing that I miss, or the thing that I miss the most, I guess is the better way to say it, is pizza.
Yeah.
Yeah.
Well, there's gluten-free pizzas.
I know, but it's just not.
Right. It's not the same. But unfortunately, you can't be a little pregnant.
No. And I've learned I can't eat it. It's not worth it.
Yeah. Now, by the time you're feeling symptoms when you're exposed to wheat, you're pretty far down the road of deterioration. Whether it's in your nerve muscle connection or in your brain or in your thyroid or in your skin, that there's been a cumulative damage accruing for quite a few years by the time symptoms develop. Symptoms aren't the first sign. They're the last resort.
Right.
That's when the body.
And that's why so many people later in life are developing these autoimmune issues, right? Which
That's
is what
exactly
all these
right.
are.
See, the development of autoimmune diseases, chronic inflammatory diseases, has 5 pillars. There's 5 mechanisms. And we think the man who identified all this, he and his team are the guys that identified the leaky gut in 1997, the proteins that cause that leaky gut that are called zonulin. His name's Professor Alessio Fasano. He's professor of pediatrics at Harvard Medical School, professor of nutrition at Harvard School of Public Health, the director of Mucosal Immunology Center at Harvard, the director of the Celiac Research Center at Harvard, and the chief of pediatric gastroenterology, Mass General at Harvard. I mean, any one of those titles is a lifelong goal, right? And this guy's got so many of them. And he's been studying this for almost 25 years now, if not more. And we think he'll get the Nobel Prize because this affects hundreds of millions of people. And
so what are those 5 pillars? Let's talk about that.
Yeah. The first one is your genetics. And you can't do anything about your genetics. That's the deck of cards that you were dealt. Mm-hmm. But we now know, the studies used to say 70%, but now they're saying somewhere around 80. One study even said 85% of the diseases you get are not because you got the gene. It's because the gene got turned up, which means it's called epigenetics, what happens around the genes. And that's where CBD comes in, and we'll come back to that.
Okay.
But epigenetics, because your genes aren't on off switches, they're on dimmer switches. And what you want to do is dim down the genes of inflammation, whether it's the Alzheimer's genes or the breast cancer genes. Those are the most famous ones that people have heard of. But any of your genes, you want to dim down the genes that express this inflammation, and you want to turn up the genes for anti-inflammation. And the way you do that is by what's around the gene that affects the dimmer switch handle, if you will. That's epigenetics. So you can't do anything about your genes. I love when people come to me and say, I've got the gene for Alzheimer's, and my mother died of Alzheimer's, and my grandmother. And I say, okay, that's great. Congratulations. Now you know. Now you know. Right? Now, you're going to learn in the next year, because it's going to take a year to 2 years to really learn, how do I dim down the expression of that gene and ramp up the genes of anti-inflammation for that tissue? How do I turn up the genes for anti-inflammation in my breasts if I carry the BRCA1 gene for breast cancer? So how do I turn down the BRCA1 gene and turn up the genes for non-inflammation, for anti-inflammation in the breasts or in the soft tissue of the body? It's going to take you a year to learn all that. It's going to be overwhelming because you're going to learn so many things. Turn on the genes for inflammation in your brain or in your breasts or in your kidneys. So many things that you say, what? Really? The plastic blinds on my windows, those plastics outgas phthalate chemicals that are in the air that I can't smell, but I'm breathing them every day, and they activate inflammation in my brain? Yes. Really? Nail polish? The phthalates in nail polish leach into my bloodstream within 4 or 5 minutes after applying the nail polish, and phthalates activate inflammatory genes throughout my body? Just Google phthalates and Alzheimer's. Yes. Really? Plastic storage containers that I store my leftover food in the refrigerator, and the next day I eat that chicken now has phthalates from the chemicals used to mold the plastic? Yes. Really? My shower head accumulates bacteria inside the shower head, pathogenic bacteria. So every time I take a shower, I get blasted with millions of bacteria like Klebsiella or Pseudomonas. The Klebsiella, the most common bacterial infection in hospitals, Klebsiella pneumoniae, because it gives you pneumonia. Yes. So I have to learn how to clean my shower head? Yes. And it's really easy. Just take a Ziploc bag and you pour 30% vinegar in there, not the stuff you buy in the store. You have to buy it on Amazon. It's really cheap. But you pour vinegar in there, and with a twisty tie, you tie it over your shower head overnight, and you've cleaned it. You do that every 6 months, and you're fine. But you've got to learn all this stuff, because the world we live in today is loaded with so many threats.
Right.
Because you only have an immune system that's the same as your ancestors, that was designed to fight bugs, bacteria, viruses, mold, fungus. There's 6. Mold, fungus, bacteria, viruses, bugs, parasites, viruses, mold, fungus, and bacteria.
There you go.
That's all our immune system can do. It's all it can do. Well, what about red dye number 42 in my Kool-Aid? Nope. Your body's going to treat it like a bug, parasite, virus, mold, fungus, or bacteria. Well, what about mercury that's in the fish that we eat now? Nope. Your body's going to treat it like a bug, parasite, virus, mold, fungus, or bacteria. That's all it can do. And when you learn that we're exposed to so many tens of thousands, I'm not exaggerating, tens of thousands of chemicals every single day in our lives that we have no protection against. I'm sitting in a hotel room right now, and the desk that I'm sitting at and the headboard over there on the bed is fake wood, is press board. press board is soaked with formaldehyde. Your kitchen cabinets, your bathroom cabinets, if they're not solid wood, they're press board, soaked in formaldehyde, which outgasses formaldehyde into the air. You can't smell it, but you're breathing it every day. The plastic blinds on the windows are outgassing phthalates into the air. The sheets and blankets and comforter on this bed are soaked in flame retardant chemicals that outgas for years. You wash them 50 times and they still outgas a little bit of chemical. Well, I can't smell anything. Well, that doesn't mean anything because this stuff is accumulative in your body over the years. I'll give you one example and then I'll stop on this chemical thing. Chicago, 2014, they looked at 346 pregnant women. In the 8th month of pregnancy, they did urine tests on them and they measured phthalates, 5 phthalates, these chemicals used to mold plastic. And they categorized the results into quartiles, the lowest quartile, the next, the third, and the highest quartile. That's all they did. They followed the offspring of the pregnancy for 7 years. And when these kids turned 7 years old, they did Wechsler IQ tests on them, the official IQ test. Mm-hmm. There's not much in medicine that's all or every. This is every. Every child whose mother was in the highest quartile of phthalates in urine in pregnancy compared to the children in the lowest quartile of phthalates in urine in pregnancy, every child in the highest quartile, their IQs were 7 points lower than the kids in the lowest quartile of phthalates in urine in pregnancy. Now that doesn't mean anything to anybody until you understand a 1 point difference in IQ is noticeable. A 7 point difference is a difference between a kid working really hard, getting straight A's, and a kid working really hard, getting straight C's. This kid doesn't have a chance in hell. Your kids, your grandkids don't have a chance in hell if their mother in pregnancy was in the highest quartile of phthalates in her body. And then just go to Google and type in phthalates and neurogenesis, nerve growth. And here come the studies, how phthalates inhibit nerve growth. So if mom accumulated phthalates in her body at a high level over the first 25, 30 years of her life, and so she's in the highest quartile of phthalates in pregnancy, that kid doesn't have a chance. And that's, most little girls start nail polish when they're 5 years old, right? And that's not the only source. There are so many sources. So you have to learn all of this to stop the exposures. And you have to learn, how do I detox? How do I get this stuff out of my body? And you have to learn all of this. Well, tell me what pill to take so I'll be better. There is no pill. And there's a bunch of bozos out there that will sell you a pill and say that you're going to detox and you'll be fine. And they make millions of dollars off of this stuff until the FDA shuts them down. And when they finally come at them with legal action, they just shut down the company and they go open a new company with a different name and do the same thing again, right? Mm-hmm. There's lots of sharks out there doing this. So, but I'm sorry to be so harsh about this. I'm really sorry, but
no, it's good stuff.
I just see so many people suffering and really trying to be well, but they don't understand.
But people have to, in my experience, people have to be open to understanding this. This is the challenge, because I've had these sorts of conversations with a lot of my loved ones, and they think I'm from outer space, right? And
unfortunately, they've got to be sick enough.
Yeah.
And get.
I'm not even sure. I've got some that are sick, and I'm not even sure that's, they want to get the pill. They just want the pill.
Yeah, and then they believe the doctors that say, take the pill, you'll be fine.
No, yeah.
So the question is, doctor, can you refer me to the study or studies that show that this is going to make me fine?
Yeah.
Well, there's really no evidence that you'll be fine, but it helps you feel better. Well, I don't want to just feel better. I'm happy to do what it takes to feel better, but I want to get rid of this thing so I can live a long and vital and, full of life, right?
Yeah. So let's go back. Let's go back to those pillars, because I know we talked about the genetics, right, and we talked about the leaky gut, right? There's two.
Right. There's the genetics. Sorry. Yeah, there's the genetics. Next is the environmental triggers that
Okay.
activate your genes. And I've given you examples of that with phthalates and heavy metals, but
Yep.
the most common, and by the way, environmental triggers are also what's inside of you that your body is producing. We call those stress hormones. Those are environmental triggers. So if you have too much stress, it's just as deadly as eating Krispy Kremes in terms of being healthy.
Right.
And I don't mean to
No,
target
I've
Krispy Kreme.
experienced that myself too, and
Yeah.
it explains things, right? I've had.
Yeah. So in environmental triggers, now the most common environmental trigger is what's on the end of your fork. That's the most common. And people think if I don't feel bad when I eat something, it's good for me. That's just not true. The ratio is 8-1. For every one person that gets stomach or gut problems from eating something, there are 8 people that don't. They get brain symptoms or bladder symptoms or joint symptoms the next day. And they never associate that their knee is really giving problems when they wake up in the morning and it's got to loosen up, got to get in the shower and loosen up. Your joints are all stiff. They don't associate what they ate yesterday is causing all that because their stomach didn't act up on them. So the ratio is 8-1. For every one person that gets gut symptoms, there are 8 that don't. They get brain symptoms or ear aches or joints or skin or kidneys or bladder. But you don't feel when your bladder is acting up until your urinary history or habits are altered. You don't feel when you eat that food that it's causing inflammation in your bladder. That's your genetic vulnerability. And so when you increase inflammation, it's like pulling on a chain. The chain always breaks at the weakest link. It's at one end, the middle, the other end. It's your heart, your brain, your liver, your kidneys, wherever your genetic weak link is, that's where you're going to feel it. But you don't have feeling nerves in your bladder until it gets so bad, it just doesn't function very well anymore. Then you notice the symptoms. So that goes on for a long time. So that's number 2 is the environmental triggers.
Okay.
So don't think because you don't feel bad when you eat a food, it's good for you. The way you find out if a food's good for you or not is by doing the Zoomers, because you zoom in on the problem. It's a category of blood tests of a new technology that came out 4 years ago. Mayo Clinic calls it a new era in laboratory medicine. It's silicone chip technology. I call it the 30-30. 30 years ago, it took a 30 by 30 room, floor to ceiling computers to generate the computing power of this phone. And if I had told you 30 years ago that I'm going to hold this little black thing in my hand, I've got a bunch of different pictures on it, and I'm going to push on one picture, and I can tell you that the air particulate matter right now in San Francisco is 34. That's pretty darn good. At the US Embassy here in San Jose, Puerto Rico, it's 13. That's really good. But in San Antonio, Texas, it's at 94. It's a red zone. That's really bad. Or in Spiazzo, Italy, it's also at 94. I mean, I can pull this up in 5 seconds. If I had told you that 30 years ago, you'd never believe me. You'd think I'd been watching too much Star Trek, right? And you just wouldn't, that's just not possible. We couldn't imagine. The same thing is true in laboratory medicine. And people don't know this, but the blood tests your doctors are doing were designed in 1990, 2000, maybe if you're lucky, 2005. It's called ELISA testing. It's good testing, but it's nowhere near the technology we have today. And so the most comprehensive tests are called the Zoomers. There's a wheat Zoomer, corn Zoomer, soy Zoomer, corn Zoomer that looks very thoroughly if do you have a problem with this food or not. Lectin Zoomers. So you can find out with a high degree of accuracy, 97 to 100%, according to Mayo Clinic, 97 to 100% accuracy. This test is going to give you accurate information. So you test to see what foods you are sensitive to. That's environmental triggers. That's number 2.
Okay.
Number 3, an altered microbiome. That the environment of your gut is called the microbiome. And it starts in the mouth with your oral microbiome, and it goes to the other end, all the way through. How important is your microbiome? In 1999, Dr. Michael Gerson at Princeton published his book, The Second Brain. And that was a game changer for many of us because we had never heard this stuff before. But he told us, and it's been proven accurate, for every one message going from the brain, going down telling the gut what to do, there are 9 messages from the gut going up telling the brain what to do. The ratio is 9 to 1.
Wow.
And how does that happen? The good bacteria in your gut have exhaust. It's called metabolites. It's just exhaust. 37% of all of the small molecules in your bloodstream are the exhaust of the microbiome from your gut. 37%. Over 1/3 of everything in your bloodstream is the exhaust of the bacteria in your gut. Why? What's that about? The term is called modulates. And it's a geek word that means has its hands on the steering wheel. So the microbiome of your gut has its hands on the steering wheel of how your body functions. Bottom line, that's it. 9 to 1 ratio in terms of telling the brain what to do. All right, brain, I want this amount of brain hormones called neurotransmitters so that we can make more melatonin. Or it's time to go to sleep now, so we need more melatonin or serotonin. Calm down, a little stress right now, make more serotonin, calm down. So your gut is sending all of those messages up to produce the balance of your brain hormones, your brain chemistry. Now, driving the car. Imagine you turn the steering wheel just 5 degrees to the right. 100 yards down the road, you're off the road. So when you've got an abnormal microbiome producing messages, there's too many bad guys in there, not enough of the good guys. The messages in your bloodstream are too many altered messages, and your brain's going, whoa, whoa, whoa. We call that anxiety, depression, bipolar, schizophrenia. Just Google depression and microbiome and look at all the studies that show the correlation. When you fix the microbiome, your depression calms down and you don't need the antidepressants anymore. For many people, you can bring balance back to your brain chemistry. So your microbiome is critical, not just for your brain. I just use it as the example.
Right.
Just Google microbiome and cardiac function, microbiome and kidney function, microbiome and liver function. That if there's only one thing you're going to do to be healthy, all right, I'll do something, but don't overload me. Build a healthy, diverse microbiome. Nothing is more important than that. Absolutely nothing will have more bang for your buck than building a healthy, diverse microbiome. It'll take you a long time to do it. It'll take you a year, 6 months to a year to do it. Yep. But every day you just lay down a bunt. You know, you keep going for base hits. You just stop going for home runs. That's the American dream. Tell me what to take, so I'm going to feel like $1 million and go out and conquer the world. And it doesn't work like that.
Right.
It just doesn't work.
So what's number 4?
Number 4 is intestinal permeability. When you have an altered microbiome and you have an inflammatory microbiome, you get this leaky gut.
What we talked about at the beginning, right?
What's the leaky gut? Mrs. Patient, if you take a donut and you stretch a donut out, one big long donut, you look down the center of it, that's your digestive tract. It's a tube. And when you swallow something, it's in the tube. It's not in your body, it's in the tube. And the proteins from the meat you eat or whatever it is, they've got to be broken down really small to get from the tube through the walls of the tube into the bloodstream. And we don't think about that, but that's what's got to happen. That's called digestion. And then getting through the walls into the bloodstream is called absorption, right? So think of protein like a pearl necklace. Hydrochloric acid in your stomach undoes the clasp of the pearl necklace. Now you have a string of pearls. Your enzymes act like scissors to snip, 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 snip the pearl necklace into smaller and smaller pieces, clumps of the pearl necklace, until you're down to each pearl. That's called an amino acid. And the inside of the tube is lined with cheesecloth. And the amino acids are small enough to go right through the cheesecloth into the bloodstream. but the bigger clumps of the pearl necklace cannot get through. They've got to be snip, 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 snip until they're small enough to get through the cheesecloth. That's why your intestines are 20 feet long, because it takes a whole lot longer to digest prime rib than it does a banana.
Yeah.
Right? So you need all that length. But what happens, one example I gave you was wheat activating toll-like receptor 4, you get tears in the cheesecloth. We call that leaky gut. And it's transient until it's not anymore. Now, when it's permanent, now you've got the leaky gut, and these big molecules called macromolecules get through the tears in the cheesecloth into the bloodstream. That's leaky gut. When those tears in the cheesecloth get through into the bloodstream, your immune system, trying to protect you, says, whoa, what's that? That's not supplies that I can build new bone cells with or new brain cells. I better fight that big molecule, that clump of whatever that is. Now you make antibodies to beef or to chicken or to tomatoes or to basil or to raspberry. It doesn't matter. Whatever the macromolecule was that got through the tears in the cheesecloth, now your body's going to try and protect you and fight it. And when you make antibodies to these macromolecules, the special forces are looking for the orange vest of that food or whatever that bacteria, whatever it was. And those orange vests look a whole lot like the tissue of your body. So just Google rheumatoid arthritis and Klebsiella, and you see that the antibodies to Klebsiella can attack the collagen of your joints. You get rheumatoid arthritis. Or Google, that's too geeky. Google brain deterioration and gluten, and you will see that the antibodies to gluten can attack your brain and you get brain dysfunction. It's why 26% of every patient in our practice that we've ever tested that had antibodies to wheat, meaning they crossed the line of tolerance, now they got a problem with wheat, 26% of those people also have antibodies to the cerebellum in their brain. 22% have antibodies to myelin, the saran wrap around your nerves. So that is one. So when you have elevated antibodies to your cerebellum, you can't feel that. You can't feel that you're killing off cerebellum cells every day, 24/7, every day, a few more, a few more, a few more. You can't feel that until you're in your 60s or 70s, and then you try to dance down the stairs. You can't. You don't have the balance because your cerebellum controls balance. Your cerebellum controls the direction to your muscles of where to put your weight. And that's why you see as we age, people are not graceful anymore on the planet. They don't walk with grace. They're shuffling, or it's, for many of them, their cerebellum's been atrophying for years because they had a sensitivity to wheat that was never identified, and you're killing off cerebellum, killing off cerebellum, killing off cerebellum.
Wow.
Same's true with your thyroid. The same's true with any tissue in your body. So when these macromolecules get through the leaky gut into the bloodstream, pillar number 5 is your immune system trying to protect you that creates this inflammation in your body to attack whatever these threats are. And that's the mechanism behind all chronic inflammatory diseases, all of them.
Well, that's amazing. Thank you for explaining that. I'm sure our listeners are going to be really excited to understand why and how all of this stuff works, because I think it's hard for people to understand how one thing can lead to so many different issues with people, right? And I think that's what causes people to not believe in it, because it causes different, like you said, whatever your genetic weakness is, right? Yes. And I certainly understand that from my own experience. But now I'd like to shift gears.
May I just make one more comment?
Yes, please.
Just one more comment on this. I know that I sound fanatical when I say this, but all I do is read science every day. You know, I'm not traveling now because of our current situation. Usually I do about 150,000 miles a year, and I'm just at medical conferences teaching and teaching and teaching. but now I'm doing interviews more often. So I'm just reading the science all the time. And that's why I was late here today. I'm sorry, Ashley, I was a little late because I went down a rabbit hole about hidden sources of gluten in vitamins. And I just downloaded
wow.
6 or 7 papers on that. But when you look at this, if you take the time, and I recommend people take 1 hour a week, maybe 1 hour twice a week if you've got that, but just start exposing yourself to some of this information I'm telling you. And read my book, my books. They both talk about this. The most recent book is You Can Fix Your Brain. That's the name of the book. It's #1 in 7 categories on Amazon for brain function because it's a really good book. But when you read this, you say, well, this just kind of makes sense. I don't need to be a scientist to understand that this makes sense.
Totally.
And then you start saying, well, it seems rational to me. Okay, indoor air pollution is worse than outdoor air pollution. Okay, I didn't know that, but you see some of the studies that I talk about, and you can get the studies if you want. But
we've built a couple of houses, and in moving into those houses, my wife has been almost debilitated.
Yeah,
because
exactly.
of her effect, her genetic weakness or whatever to those triggers.
Yeah.
Very clear and apparent.
Yeah. It's most likely that she has some genetic vulnerabilities in her detoxification capabilities. And that's an easy test to do to find out. It's called the detoxigenomic test. And if you've got these vulnerabilities, if you've got these genes that are vulnerable to not breaking down the chemicals we're exposed to, because no human's got the ability to break down these chemicals.
Right.
None.
So how does
Parasites, viruses, mold, fungus, and bacteria. That's it.
So how does cannabis and CBD come into this?
CBD activates the endocannabinoid receptors. What the endocannabinoid receptors do, and they're throughout your body, what they do is they say, all right, let's activate the genes for anti-inflammation. And they do a really good job of that. And basically that's a bottom line.
That's what it is. So if you stop eating the stuff that's causing wheat, number one, if you stop eating wheat and you begin to supplement your diet with CBD, then you should be reducing the inflammatory responders or whatever you want to call it, right? And you're also increasing then the anti-inflammatory response.
That's correct. And the danger and why I agreed, to do your show is that CBD doesn't fix anything.
No.
If you're still living the same lifestyle that caused the problem.
Right.
Now, you're likely to feel better, which is really great, but the inflammation can still be going on, or the antibodies certainly are still being made. You're killing off your brain, or you're killing off your thyroid, or you're killing off your joints, wherever your genetic vulnerability is, but you feel good, right? And not that you're altered, because CBD doesn't alter, but you're just anti-inflamed, and so your joints are moving better, right? So I just want to make sure people understand that. CBD is a great tool, a really great tool to activate more of the anti-inflammatory genes in your body. It's great for that. But you've got to stop throwing gasoline on the fire, or 10 years, 20 years down the road, your hippocampus, your memory center is gone, and you're going to be, Blue Cross Blue Shield just came out this year with a document. And if you can imagine, they're arguably the largest health insurer in the world, right? And they are not a good Samaritan. They're a profit-driven company,
of course,
right? And so they just came out this year, and they showed that the incidence of Alzheimer's in between the 35 to 50-year-olds between 2013 and 2017. So in 4 years, the incidence of diagnosis of Alzheimer's in 35 to 50-year-olds went up 407%. 400%, not 10% increase, not 30, 400% in 3 years.
Wow.
that what's happening now, there's an epidemic occurring that people just aren't putting any focus on whatsoever. How many of your friends talk about, yeah, I'm not remembering the way I used to? You know, that
Yeah.
most people have that going on now to some degree. And what's happening
And that's
is the
that's an awful thing to witness. My great grandfather passed that way, and
exactly,
it went like
exactly.
that in terms of he couldn't even remember my name, you know.
Yeah, yeah, and
Crazy.
I'm telling you, and the incidence of autism at the other end of life, the early life,
Hmm.
and these
Yeah,
kids'
off the
brains that
charts.
just off the charts and going up exponentially every year. It's really bad right now, and so I'm suggesting to every patient that comes to us, there's two tests they do: the wheat zoomer, because it not only is the most comprehensive test for wheat sensitivity, and all humans have a problem with this. It also tests for leaky gut. It's the most comprehensive test for leaky gut in the wheat zoomer. And then the neural zoomer plus. You do those two tests because the neural zoomer plus looks at 48 different antibodies in your brain. 48. And we haven't had anyone come back normal on the neural zoomer plus because everyone has inflammation in the brain, but they just don't know it.
Right.
So when this thing comes back on a first test and it says you've got 16 markers in your brain of inflammation, well, this explains, Mrs. Patient, why you've been noticing that your brain's not quite firing on all 8 cylinders the way it used to. This is why. You got a bunch of inflammation there. And then the patient says, well, why do I have the inflammation? Let's figure that out. Let's look at what the environmental triggers are that are setting off the inflammation. For some people, cosmeticians are loaded with chemicals because they're doing hairspray and dyeing hair and their nail polish, and they're
Right.
around chemicals all day every day, then their bodies have been soaking it up, and that's their trigger. For somebody else, it's too much wheat. For somebody else, it's too much dairy. For somebody else, it's the phthalates. It's going to take a while to identify where the environmental triggers are coming from, but the first thing you need is to get scared, to realize that. And if you have a family history of dementia, absolutely, Ashley, you should do
Yep.
this test. And as a matter of fact, I'm going to call you out. I'm going to say, listen, man, you're a health podcast. Do the test
Right.
and show people what your results are and say, all right, now I'm on a journey and we're all going on this journey together to figure out what we do about this, right?
Hmm.
So if you want, you get a bunch of people to do these tests with you. I'll come on and I'll talk about it with you every once in a while. I'll help you.
Okay.
Or you find a healthcare practitioner to do it, individually, who knows about these tests. We're training doctors every week. We're doing webinars now and not on stage at this time. Hope to get back out there pretty soon. But we're training doctors all the time, and they had no clue about this technology, silicone chip technology, about the accuracy of these tests, or about the frequency of this. Doctors don't have a clue. So
I guess what you're saying, because if I understand it, we all have the problem, right? So the ideal thing is just stop eating wheat. You don't need to get the test. But you're saying, hey, maybe get the test, and that way you can confirm to yourself that that this is a good lifestyle change to make.
Well, that's a good point. But the problem is there are so many hidden sources of wheat that people don't know about. As I mentioned today, I went down a rabbit hole on hidden gluten in vitamins, and companies are lying about it. That you can feel better, but you still may be throwing enough gasoline on the fire to trigger the autoimmune mechanisms wherever your genetic vulnerabilities are. But you may get more energy when you go gluten-free, or you might lose 15 pounds in a couple of months without trying when you go gluten-free. That's a healthy thing. People are packing that extra weight, but you need a starting point so that 6 months or a year later, when you're feeling pretty darn good, but there's still something a little out of balance, you do the test again and you say, oh, look,
Benchmark.
I still have 2 markers out of balance. Why is
Mhm.
that? Well, you're getting an exposure somewhere. We have to really meticulously, and we've had people find out that one gal, she would do a candy, a little mint every day that's on the counter that the receptionist in the medical office, this is a doctor,
Oh, wow.
and her receptionist had put these mints out every day, and she'd have one a day or so. And she found out that 4 months earlier, the receptionist had changed companies for the mints, and the new company had gluten in it. So she was getting a little gluten every day. And it took months and months and months before she realized, hey, there's something wrong. I better do that wheat zoomer again. And then she found out that she had a number of antibodies elevated. Then she did the deep dive to figure out, okay, what's everything in my world? What's going in my mouth? And she like,
Right.
no, wait a minute. What are the honey, or not honey, but the receptionist, where did these come from? Call the company. Oh, well, yeah, we've been using these for a number of months. Well, wait a minute. We've been using those mints for a couple of years. No, I changed it about 4 months ago. That was it. And
Wow.
she didn't know. So you need the benchmark to start with so you can monitor and make sure you're thorough. Because
All right. Well, I'm going to check it out then. That's
one more
a good
thing on
idea.
that. You can't be a little pregnant. You can't have a little gluten. All it takes, and the science is very clear, nanograms, a billionth of a gram will activate toll-like receptor 4 in the proximal part of the small intestine. A billionth of a gram.
Holy
That's
moly.
like, what?
So that one little
Because your
bite.
immune system, yeah, is trying to protect you from pathogenic bacteria that it could kill you.
Right.
And so the more efficient your immune system is, because the immune system mistakenly sees gluten as a harmful component of a microorganism. So it just billionths of a gram is all it takes.
Dr. O'Brien, thank you so much for your time today. This has been absolutely fantastic. I've learned so much, and I think our listeners have got a lot to think about here with regards to diet and how to make life changes, and understanding that CBD can be a piece of this, but it's certainly not a magic bullet to cure everything that we're talking about. It can be a tool to help.
And Ashley, I made this comment, this offer to you, and I've just completed a study on LPS, the exhaust of bad bacteria. And we had 120 some people who wanted to do a keto diet. And lots of people, there was a keto summit, and I said on the summit, the only danger is if you've got LPS, you can't do a keto diet because you'll get worse.
Right.
And so a bunch of people said, what the heck is that? So we just completed a study on this. It was 90-day study, and the results were jaw-dropping. So if you get 25 people or more that want to do this, and they'll do the Wheat Zoomer and the Neural Zoomer Plus, then I will do webinars for you, just for you guys, about, or if you want to make it, for everybody, you can, I guess, but how to interpret the test, what do you do, and then you recheck in 90 days or 120 days, and what does it mean, and watch what happens to your health.
Awesome. I'm going to take you up on that. I'll follow up with you in the next couple of weeks.
Great.
Hey, thank you so much. Have a great weekend, and thanks again. Very informative.
Thank you, Ashley. My pleasure.
Be well.
Thank you for listening to today's show. Always brought to you by Magic Immuna Tea, available at packedwithlife.com. A mushroom tea that tastes great. Try it. Magic Immuna Tea, packedwithlife.com.